So where you can find them, you have the sternocleidomastoid, which maybe you I cannot see. Just patient lift the head, sternocleidomastoid, yes, and then you go under it. And there I already feel here the processus transversus. So when this is the processus transversus, you go with your finger, on the processus transversus, and then do you this gliding technique. So the scalene comes from the front part of the processus transversus, goes to the rib. So contracting the scalene, when they contract, it goes slightly in this direction. And also the lateral flexion on the same side. So first we find it, okay, here I find the scalene. Then do this gliding technique, and then you can do the lateral flexion, and even slightly more lateral rotation. And try to follow the fingers so deep as possible down. Almost to the ribs. You see patients when they do this, I feel here, or when they do this, I feel it on the same side, the scalene. So you do this, and you test again, sometimes when you know, they can go further, or this pain, pulling is away, and sometimes when you do this, then it's also okay. So you do this 3 times. When you have small fingers, you get quicker tired, you compress one finger on the other, so you have small support, and then lateral flexion. Posterior of the medius is on the processus transversus. Relax. Processus transversus. Anterior was more here on the front, so I go the front down. Medius is more here. Be careful because the nerve are also coming out on that side. Go here down. And the posterior, processus transversus, anterior is up. Here, posterior is you go below, under, give compression a little bit with your finger, and you go down here. And some patients, when you do this, they feel tingling in the arms. So when you give too much compression, you feel the tingling, give less compression. Or sometimes there's, it's tight, you wait for release, and it's also. And especially patient also when they breathe faster, the muscles do much work. Okay, breathe in, breathe slowly out when it's painful, and when it's slowly out, you do your gliding technique. This, don't know yet. Okay, this, you have 2 approaches. Okay, with this muscle, especially whiplash patient, I see it often, whiplash patients, some 4 or 5 years old, I cannot do this, it's painful, because when you get a trauma, it goes in front, and then your head goes extremely backwards. So this is a flat muscle. This is on the front of your corpus. So I show you maybe a technique, but maybe it's a little bit easier. You go here on the side to feel the processus transversus, both sides, both fingers. You go under the sternocleidomastoid, on the corpora, and then you do glide. Relax. The other technique, you say to the patient, I go in the deep. So what you need to pull the trachea a little bit to the side. But first, when you go in the deep, first you need to find the arteria. So, shall I go in?
Yeah.
Make clean in your fingers. Sternocleidomastoid. We go there in the deep. Here I feel the arteria. So the arteria should be on your lateral side. So I feel the arteria on the lateral side.
Exterior.
I push the air pipe a little bit on the side. And when I go down, I feel already the corpora. I feel already the between two corpora and where this space is in between. I feel it here already. And then you bring it slowly down. So always do this when you find the arteria. When you don't find the arteria, don't do it. Otherwise you squeeze the arteria. And some people can feel that they have this coughing. That's normal. So you go down. So you do it both sides. Arteria is on the lateral side, just trachea on the side, and then go down. Look with your partner when you have problems with the extension. You do the extension, okay, it's limited, you do this, and then you look again. 3 times both sides. Yes? Mobilization.
Come a little bit up. We do now a few little bit more special mobilization techniques. Like this was all on the fascia, around the muscles. Now we're going to look a little bit more at the fascia around the joints. We already did the release of the suboccipitals, but it's also good to see how is the movement. Can you move easily up like this? So just lifting the head. This is now very easy. You don't feel any resistance. If you feel resistance, you keep your fingers, what you call a wedge technique. You keep your fingers vertical. And now you let the head drop backwards. And you just keep the pressure and you wait. Again, it's not mobilizing. I don't push any further, but I wait until, and now I feel already the tissue is giving in a little bit. So it's a very gentle form of mobilization of joints, but very effective. And it's not painful normally. How is it for you? So you can check at any level. You can go a level lower. Again, feel is a movement, is a difference if you push a bit more on the right or on the left. If it's limited, I just go to the end position and I just wait.
So the difference between this and a thrust is, because when these are your 2 spines, you give compression here, 2 spines of because this is your spine, your vertebrae. When you give this push here, the vertebrae will move this. So also the fascia on the front side you make loose.
So I checked with him, and actually with him it's very mobile, but very, very, very often you find problems at the CTO, cervicothoracic, how do you call it?
Cervical thoracic
Joint junction, G. And now I do the same thing, slightly different. I put my fingers like this, one and the other I put just behind that, one level lower. And now I give a pressure up to the ceiling. Yeah, this is difficult to see, but I do it a bit exaggerated. I give this pressure. And can you
Carefully watch.
So I go to the end of movement and I just wait. direction of my pressure is up to the ceiling and slightly up that way. And again, I'm just going to wait. A lot of people with headaches, especially people who are hypermobile, they often have a very mobile neck, but they have a very stiff CCJ.
You see also the rotation
TCJ.
improves without doing no thrust movement. Because when the tissue is tight, you do thrust,
Here it goes a bit
tissue
further.
falls back, and then the next time you have to do it again.
And you even can go further. Can you come up a little bit? Up a little bit? Yeah, no, you just got this. I put it down low, put your head down, put your head on my arms, and now you can see what I'm doing?
Mm-hmm.
So you can just choose the level that is tight. You don't have to be a manual therapist just to do this. You can keep your hands like this. And start giving in. Sometimes manual therapists get a little bit annoyed because it's a very easy way to mobilize. And in the old days, if I couldn't mobilize something, I went to a manual therapist. But these days I don't have to go because in this way it's very simple to mobilize. And of course you can bring a little bit rotation in this way or that way. You can a bit push against the processus spinosus and you wait again in the end position in these ways. It's not more complicated than that. An alternative way to hold is like this. We call it like billiards. Then I put my hand under it like this, when you can see it. And now I have even a little bit more leverage. I can move, you can see it, to the left and to the, from the top maybe. You can see it, I move it to the left and to the right. So if I bring his head down here, I can, okay, you don't mobilize like this, you go to the end and then you wait until it releases. And again, this is a technique you can use on any joint in the body. Don't mobilize, go to the end and just wait. Yeah. Can you lay down again? We already did the superficial release technique on the back. It can be useful, but the place where it's most often useful is on this part, on the sternum. There's a lot of tightness here. So what you do, you check and see whether the fascia is loose. Of course, we have a slight problem here with women, but so you always have to ask permission. It can be very tight here, and treatment is very easy. Put your hand on it. Here you need to use a little bit more pressure than you use on the back side. It's always more tight here, and you put your hand on it. Not like here, but really on the place where you feel it's tight. And I give the pressure is on top. So up to the and again you wait. People often feel very tight or compressed on the chest. I have a lot of patients who already went to the how do you call it, ER, and then they got film for the heart because they felt pain here, and it's just a matter of that this is tight. Once you release it, you check it, say, okay, now it's more subtle, more loose. Very easy. And a lot of people say, oh, I've been breathing a whole week. It was so easy to breathe. And once you've done it, the first time you can teach the patient just to do it her or himself, put the hand like here and mobilize this. Waar zijn we? Where are we? Yeah. If men are very hairy here, sometimes you have to put your fingers in a little bit more, otherwise you slip away. Okay, you have it? Okay. Now we're going onto the diaphragm. Mostly we start on the right, on the left side.
You start on the right side wide. On the left side, sorry. You start on the left side wide. On the right side, is your liver. So some people, when they drink too much, liver can go big. So when you start on the right side, then it's painful. Then when you go on the left side, people are afraid it's also painful. Then you get this more contraction. So on the left side, it's easier to go in.
So what you can do is bend the legs so the tension is away from the abdominal muscles. You press on the thorax. You bring your fingers under it. The other day I had an old man and he had been having pain on the right side in this area for 5 years. He had all the scans and echoes, he thought it was his liver. We couldn't solve it, and then he came and then I checked it and I moved with my hand like this. And I found very clear trigger points, and I treated the trigger points. And once I treated the trigger points, in 1 or 2 treatments the pain was almost completely gone. Okay.
You find in your trigger point when you give pressure, just by breathing in, so the diaphragm goes in and out.
You put a little pressure on the right hand?
Yeah, on the right hand also, I'm really, so to get more space to get deeper. So I'm leaning a bit into the tissue. And very often here in the middle part, then you feel a lot of tension in the diaphragm.
How many seconds?
Again, just wait until it releases. Now it's giving in, start giving in, start moving.
Toma, anul trecut am avut altă priză, mi-a arătat altă. Da?
And you can go more down.
Știu.
Da.
Tot pe ocul. Asta e nou.
Da.
And then you can after it, so that's more for the trigger points. And if you want to go more on the fascial part, then you start pulling it gently. What I often do is I take the arm, hold the arm like this, and now very gently. This is more like mobilizing the soft tissues.
Imediat.
And you hold this for a while until you feel that it's not giving in more, and then you go gently, go back.
With some of the patients, you find it difficult to go in. So when you find difficult, for example, to do this technique, first ask the patient, breathe in and breathe out. And when they breathe out, you go with your fingers in. Then you wait, stay there, breathe in, breathe out. And then you look, okay, can I go more? And then I can go more. So I stay here. Maybe 2 or 3 times. You stay here and then you can do this technique. Because some people with a lot of storage for the winter, it's difficult. Then you ask them and then this goes easier.
He's not agree.
Cold winter, so
Alternative hand position is like this. And again, you can go a bit more to the left, to the lateral side, or you can go more in. And actually, you can even do both sides at the same time. You just sit down and
Take the chair.
take the chair.
we show you different techniques to use it because with some patients this is possible and some patients it's not possible. For me, I'm a little bit small, so when I have a long, tall guy, it's for me not possible. Then I do 1-1. Sometimes you can do the variations of this one. Have a seat. First film on the side. What you do is you put your leg cross against the patient. Patient crosses the arms.
Ce poziție?
patient is bending to you, so he's lying on you. Then you feel where are the ribs. The patient is breathing in and out. Then you go under the ribs,
And take the heart.
in and out. And then when he's breathing out, I give push to the side, cranial and lateral. And keep this.
You can even take the patient a little bit more backwards to
Because when you have difficulty, when you go backwards, your arms automatically go more lateral. Of course, when people are very, for me it's not possible. Lifting.
Right?
It's not lifting.
Oh, the lift, yeah.
Yeah, okay. Last one. Abdominal lift.
Yeah.
Hands like this. You just bring your elbow together. That's it. So you lift the abdominal. You do this.
The rectus.
You do this. You bring your elbow, legs down. You bring the elbow down, and then just the leg, and you lift.
And then you can even twist it.
You can also move slowly to this side. But with some people where it's painful, you don't do this. And it's okay, then you can see, okay, how is it?
It's painful, you do it. Yeah, but I mean, more relaxed.
It's letting now loose, so my hands can even go further up.
Perfect.
Yes?
With 100 kilos, you cannot do that.
With this, yes. With the, we have another technique. With this, it's more difficult. But this is easier.
There are different ways you can also, if it's easier, you can do it like this.
For me, I'm small, so the leverage for my arm, I have to push, give more power. So
But if you want some bigger, you can also just do one side.
yeah.
You can always use a variation. There are different possibilities. You can mobilize the tissue in different ways. Okay, just want to show variation. You can use your imagination and that's it. Thanks a lot.